डॉक्टर्स का सबसे भरोसेमंद सैवलॉन एंटीसेप्टिक लिक्विड है कोविड-19 कोरोना वायरस पर असरदार।
Hello and welcome to a special edition of Expressions brought to you by the New Indian Express and Savlon. I have with me former Union Home Secretary, Mr. Madhav Godbole. Mr. Godbole, welcome and thank you for joining us. You're joining us from Pune?
Yeah, that's right. Thank you.
Thank you so much. So, Mr. Godbole, you've been seeing what's been unfolding in India over the last more than a year now. As former Home Secretary, as someone who understood or understands how governments work at the center and at the state. You were in Maharashtra for many years. What really has gone wrong in terms of decision making?
Last few months have been an unmitigated disaster.
Right.
Put bluntly.
Yes.
Because I think what went wrong was from the very first announcement of a national lockdown. It was criticized as being unduly harsh, etc. But according to me, the biggest fault was that this was done without consultation with the states.
Right.
We are a union of states, but we are a federal union of states.
Right.
So there is some discipline to be observed both by the center and by the states in dealing with each other, which
Right.
in this case was not done. Secondly, I find that it is often lost sight of in all this debate on this question, is that health is not a central subject.
Right.
Health is a state subject. Clearly under the seventh schedule of the Constitution, it is a state subject. Where does the center come in? Center comes in because of pandemic situation. And therefore it expects the center to intervene and take certain initiatives. Then it is necessary to realize that center has to take initiative in respect of broad policy matters at the national level, not nitty-gritty,
Right.
not micromanaging as is being done at present. Advisory is being issued by Government of India on everything else. And therefore, in common man's perception, everything which is wrong with the management of COVID pandemic is being ascribed to center. According to me, this is not so. It is only partly so. We'll look at both sides of it as we go along. Firstly, it is necessary to distinguish that there is a responsibility to be shared by the states and the center, which has not been done adequately and clearly so far.
Right. Now, having said that, there are certain decisions that only the government could have taken, central government could have taken. For instance, while the lockdown was in place, it could have started the manufacturing and the acceleration of vaccine rollouts. You know, that was very important. That time could have been used because we knew that we had to be vaccinated. I think the whole world knew that.
Yeah, sure.
Why did we drop the ball on the vaccination part of it, despite
Well, that is one of the
ability to be a manufacturer for the world?
Well, that is one of the unanswered questions so far.
Right.
Because central government, which took the initiative in terms of announcing the first national lockdown, suddenly seems to have backed down.
Yes.
Why has it backed down? Is it because of the reaction which was received nationally as to whether that lockdown was necessary or not, and whether it was done preemptively without consulting people, taking people into confidence? But the reaction now has gone to the other extreme.
Yes.
That the government of India has withdrawn itself completely from it.
Right.
For example, on an important issue like vaccination.
Yes.
The conditions in which India is placed, there is really no other alternative to deal with pandemic like this one except vaccination, universal vaccination.
Yes.
And that is something which ought to have been the first priority of Government of India, which Government of India seems to have given up. Secondly, importing from abroad or domestically procuring is something which ought to have been done centrally by the central government. I do not know why the center is not is not inclined to do that and leaving it to the states and even to municipal bodies.
Yes.
Thirdly, according to me, in Indian situation, and particularly looking to what is happening in the rural areas, vaccination must be made compulsory.
Right.
People often say, look at what happened during family planning. But family planning was another era altogether, and it concerned another subject. This is something which relates to saving of lives, lakhs of lives of people in India, and therefore it must be made compulsory. Why is it that it cannot be made compulsory? Government of India has powers to declare that it will be compulsory on the part of everybody to get vaccinated. Therefore, suddenly there seems to be a vacuum in terms of decision making. The pronouncements which are coming, for example, from Government of India agencies, including NITI, regarding vaccination, are most confusing.
Yeah.
And therefore, I believe that the whole strategy of dealing with this pandemic needs to be restructured to draw a line between what the center will do and what the states will do.
Coming to that point about vaccination, sir, India has seen such successful vaccination drives, the most recent being polio, where the rest of the world and lots of other countries have struggled with polio vaccination. We were quite successful in doing that.
Yeah, quite.
So we have models in place. We have been doing this for many years. Why have we lost our memory, our institutional memory of how we made that a success, and why can we not make this a success as well?
Oftentimes it is also because of desire to show that you are the first one to do this in India.
The first one to do everything in India.
Everything in India. So, for example, both in respect of smallpox and in respect of polio, we did excellent work without tom-tomming about it.
Yeah.
And it was all done right up to the village level in a very systematic manner. Therefore, which I said earlier, micromanagement by Government of India is not called for. Leave it to the states.
Yeah.
They are the ones who are to deal with it from day to day. They know how their system in their villages and towns and cities works. And therefore, Government of India from Delhi to try to manage everything, world change in the entire country is not right.
Right. Also, sir, if I may ask you, you've been at the center before. When the responsibilities of the health ministry were very clearly demarcated from whatever planning went on in the planning commission. Now it seems, although the planning commission has been abolished, the NITI Aayog, which has replaced it, seems to have devolved upon itself all the powers which should actually be with the health ministry. I find that a very peculiar situation, given that the planning commission was abolished for this very reason, that it was too centralized and the states were not getting adequate representation. Please walk me through this great contradiction.
Well, from what I can see, I'm told that there are more than 12 task forces which have been appointed for the purpose.
Right.
And there is one task force under the chairmanship of NITI member.
Yeah, Dr. Paul.
Yeah, dealing with vaccination. But all others are in various
logistics.
Yeah,
all sorts of.
They are dealing with their own areas of responsibility. Therefore, in principle, there is nothing wrong with centralization, particularly in a situation in which we are placed. There has to be a focus for all decision making, and that focus must be responsible for actions which are taken or actions which are not taken. In this case, there is no responsibility whatsoever. Right. Nobody has accepted responsibility.
Right.
I mean, this is a peculiar case of a democracy in so-called largest democracy in the world, which refuses to fix the responsibility for actions and inactions in a major pandemic like this.
Right.
You must have seen in United Kingdom, for example, there is not only a parliamentary inquiry which is going on,
Right.
but the Prime Minister was forced to announce that he is going to set up a high-level commission of inquiry to go into what went right and what went wrong. It is not as if problems are with implementation only in India. There are several other countries. France is in the same situation. Japan is in the same situation. Germany is in the same situation. People are critical of the way the governments have behaved. In USA, for example, during Trump's regime, there are major problems with the implementation in respect of handling of pandemic. Therefore, problems are not peculiar to India, but there are ways of dealing with it. We are shirking from responsibility, accepting the responsibility, or even discussion on these matters.
Right.
For example, Parliament does not function during this entire period.
Yeah.
I'm not able to understand.
Yeah.
Why should Parliament not be convened to discuss these issues? Parliamentary committees are not permitted to function because virtual meetings of parliamentary committees are apparently anathema for the secretariats of the Parliament Secretariat. I'm not able to understand which world are we living in.
Yeah.
Therefore,
If common citizens can do it, why cannot the government and parliament with all its resources?
Exactly. Therefore, discussions of this kind could have been held in the legitimate forums envisaged in our constitution in terms of parliament, in terms of parliamentary committees, legislatures holding press conferences. For example, there has not been a single press conference, national press conference held during the last few months. Should it not be there?
Either by the health minister or the prime minister.
Yeah, and in fact, I would say in situation like this, it should be the prime minister.
Yes.
Who could address these meetings, and media persons like you should have an opportunity to ask questions. But that is not being done. God knows reasons why. We are redefining democracy in India.
Right.
I think that is the problem.
We have decided that we're just an electoral democracy. Let's go from election to election and leave the functioning of democracy to, God knows who.
But, particularly problems in rural areas is something which is unthinkable.
Right.
The extent to which there is a misery, there is a total neglect, irrespective of what is announced in terms of advertisement in one state or the other, how well the state is doing. But reality on the ground is really frightening.
Absolutely. And which brings me to my next point, that we are a government, we are a democracy where we've tried to gather data. In fact, we're supposed to be quite good at gathering data now. We have Aadhaar in place. We have all sorts of other instruments with which to have surveillance and gather data. Why do we have such a blind spot about data relating to testing, infections, deaths? Everywhere we are told deaths are being underreported, infections are being, and we have evidence now, both large and small. And if we don't know the size of the problem, how can we possibly attack it?
I entirely agree with you. But the problem is not only with the center, because the information or data which is being collected and compiled is by the states.
Right.
So if there is a deliberate effort to hide it, it is all over the country. And therefore, a national climate needs to be prepared for what, as you said, people must know where we stand, what the real situation is, and therefore real data must come forward, which is something which is not happening.
Right.
And these are the kinds of things when I said the role of the center. The role of the center should be in terms of exhorting the states to bring out first-rate, up-to-date, and accurate data on the basis of which national policies can be compiled.
Right. Not only about numbers, but also about geographical spread, right?
Sure. But,
right?
but the trouble also is that so far as rural areas is concerned, there is really no coverage in terms of this data. We became conscious of it only when we saw bodies floating in Ganges. But I mean, that is a terrible thing to do for a country which calls itself the technologically most advanced nation in the world.
Right. And which also brings me to that other point. As an IAS officer, the enormous machinery down to the ground that, is accessible and can do all this, from the DMs to block level, district level. There are enormous number of people who can do this as well. So is it also a failure of the bureaucracy? We keep talking about the political leadership. What is the role that bureaucrats have played in this?
In a democracy, you must really tell the bureaucracy that this is the task given to you.
Right.
You will be responsible for implementing it or executing it.
Right.
This does not, apparently that is not so in most of the states. And therefore, for example, where responsibility was given in respect of Mumbai Municipal Corporation, you saw some very good results. There have been cases of district magistrates in some far off rural tribal areas doing exceedingly good work because they were given that freedom to operate in that manner and to show results, and they came up to that expectation. Therefore, there is some failure, both administrative failure and also the political failure in terms of taking the bureaucracy into confidence and making them exert their best or bring out their best in this situation.
But sir, shouldn't the bureaucracy itself have its own mechanism, its own self-correcting mechanism as a robust institution and a robust part of the democracy or part of our democracy? Have its own system of putting things to right, of naturally collecting data, of naturally upgrading, infrastructure. These should be second nature. It should not need a politician to tell them what their job is.
No, I think let us take the case of health infrastructure, which has come so much into prominence in this pandemic. The problem lies with the fact that our priorities were topsy-turvy in terms of planning. That the allocation of funds year after year had to be done by the state legislatures and by the governments of the day. And they said greater priority is for areas like irrigation or for agriculture or for power, which was not wrong. But in the process, what happened was areas such as education, areas such as health got neglected. And therefore, with a limited capacity, financial capacity, the states were left with just 1%, 2%, at the most 2.5%, 3% for these critical sectors. Now, overnight, you cannot expect the infrastructure to be built up. I find all manner of writings these days that you must do something about infrastructure. But infrastructure, like medical infrastructure, health infrastructure, can't be built up overnight. Your priorities have been misplaced all these years, and they will now have to be rectified.
Right. But do you see that will even now?
I hope so. Because
is there anything in evidence to suggest that people who have the power have finally woken up and realized that these are important things to invest in?
The trouble is, in India, as you must have seen, one crisis follows another crisis. Right. Therefore, the moment new crisis opens up, we will forget about this crisis. And then we will go back to our old ways of planning, of allocating resources, etc. And then again, these sectors will get lower priority. Therefore, there has to be a national dialogue in terms of amongst all political parties as to what should be the priorities. And this is where the center should come in terms of providing a leadership, which is something which today nobody is talking about. And in fact, as you must have seen, there is hardly any dialogue between the center and the states these days. I don't think center-state relations, except during the period of Indira Gandhi, center-state relations had not deteriorated to this extent at any time in the past. Most of
Yeah.
the states and the center are not on talking terms.
Right.
Therefore, suggesting anything that we should all sit together and do it, leaving aside our political differences for some time, is something unthinkable today.
Right.
Therefore, it will mean starting from the scratch in terms of uh, putting our heads together, both as at the center and the states. The center cannot do it alone. The states cannot do it alone, as we have seen. It is only by them, all of them working together, that it is possible to deal with these issues.
In a summary, Mr. Godbole, if I were to ask you, let's list 3 immediate priorities for the center and 3 long-term priorities. As you said, infrastructure cannot be built in a day. Vaccination, of course, we know it needs to be ramped up. Even that will not happen overnight. What are the 3 immediate steps you think that the center should take? And what are the 3 long-term uh, goals that it should look at?
3 immediate things which the center ought to do. First is vaccination. Vaccinate, vaccinate, vaccinate. That must be the first national priority.
And make it mandatory. Why not?
Mend it compulsory, make it compulsory. And for that purpose, undertake a legislate, issue an ordinance if necessary, to give effect to this immediately. But naturally, people will ask, you are making it compulsory, but where is the vaccine?
Exactly.
Therefore, the next question, which is important, is procurement.
Right.
And procurement responsibility must be taken by Government of India in no uncertain terms. Thirdly, that vaccine must be made available free.
Right.
I don't understand in terms of the cost-benefit analysis, anybody will realize that this is a much cheaper option to select in terms of making vaccine free to everybody, and then make an appeal, as Prime Minister did in terms of LPG or in terms of concessions, railway concessions to senior citizens, that voluntarily they should give up their concessions, all those who are well-off sections of society. And lakhs of people came forward and did that. And I'm sure crores will come forward to do it, to contribute to the fund. If the Prime Minister says, I'm making it free, but all those who can afford should pay into this particular account. You are not only for your vaccine, but also for the vaccine of others. Therefore, you ask for 3 things. I would say 3 things are: first, vaccinate. Second is make it compulsory. Third is let center take the responsibility fully and make it available absolutely free of cost to everybody, irrespective of where he resides in India, and all residents. The question of long term. Long term, you talked about abolition of Planning Commission and setting up of a NITI Aayog. NITI Aayog, for example, everything these days is looked at politically. I don't think India was polarized as much as it is today at any time in the past. I was just reading in the newspaper this morning, a meeting of the GST Council, Goods and Services Tax Council, which was held under the chairmanship of Finance Minister this morning. Earlier there was a meeting of all so-called opposition states. Technically, there is nothing like an opposition state, and all of them are governing. But we in India call them opposition states. All these 10, 11 opposition states got together and decided on a strategy which they put forward before the finance minister. The whole purpose of the GST Council was to run this particular tax in a consensual manner, without keeping political differences aside. And therefore, this is a very wrong path which we have chosen in terms of holding these kinds of meetings and putting together their consolidated or their joint stand on the subject. Same thing is happening in NITI Aayog. In NITI Aayog also, there are chief ministers who are not participating.
Right.
Now, if you do not participate in consultative process in a democracy, then democracy has no meaning.
Right.
Then there will be no meaning, no democracy in India. Therefore, Niti Aayog must undertake some of these long-term tasks that you asked about in terms of holding discussions. And I think these decisions are not to be taken by Government of India alone, but they have to be taken jointly with the state governments in a forum such as in Niti Aayog or whatever name you give it. But these must be deliberated with the states and also in the parliament.
Right.
It is necessary that all political parties express their point of view. For example, you had a former chief minister in India who said this is a Modi injection, or this is a Modi vaccination, or RSS vaccination. How much misinformation you in the process, how much misinformation you spread and create resistance to adoption of something like vaccination. And therefore, political dialogue has also to become a little more mature than what it is so far. Not looking at it purely all the time from the point of view of next election, which I am going to contest, but from the larger interest of the country. And therefore, questions like what should be the priority? In fact, I would say all states and the center should agree that the allocation, budgetary allocation for health and education must increase progressively from current 1.5–2% to 6% in a laid down period of time.
Right. And, sorry. Go ahead.
No, please.
No, and these are things that have been repeated again and again by so many committees. Even the new education policy says education should be 6%. Health, we have heard for so long, and in developed countries, it's something like 16 to 17% of the GDP, and we're still struggling at 1.5% to 2%. So these are things that we all know, and yet we choose to be willfully blind to them, despite the fact that people in power, I'm sure, know of it. If common people like me know, surely people in power know.
Trouble is, once you sit in a chair in North Block, South Block, or its equivalent in the state, your whole thinking process changes. And therefore, you no longer think like a common man, and then you start looking at things differently. But you are absolutely right.
What happens, I wonder? It didn't happen to you.
But you should really, as a part of your investigative journalism, you should really explore this area. This is really worthwhile exploring, because does
that really happen, Mr. Godbole? Does the mindset really change?
Yes, it certainly changes. Overnight, a person looks different, behaves differently, his body language changes, everything changes.
Just because of the position.
Because of the position, and we have abolished princely states, but that princely state mentality is still there. And still we give up that mentality, it will remain. For example, on the question of increasing allocations for states for subjects like health and education, if that has to be done, or at the same time, I would say also law and order and justice.
Right.
We hear so much about pendency of over 3 crore and 4 crore cases in the courts. No political party is prepared to talk about these because there are no votes in this. There are votes in these subjects only when pandemic comes or when a crisis arises. And this is also a legacy of leftover of our socialist ideology, that we don't want to leave anything to private sector. We want government to do everything. Government with its limited resources then has to look after irrigation, has to look after roads. Why can't roads be built by private sector? And let them pay for the services which they receive by way of communication, or for that matter, irrigation. But everything has to be done by the government, and therefore the legislature and people who sit in legislatures all over the country, they say, where is my vote? My vote is if I provide for larger funds for roads or for rural roads or for power or for irrigation. And therefore, these other sectors receive lesser priority. Therefore, one must really think in terms of arriving at a national consensus that sectors which need to be given higher attention will be the priority sectors, irrespective of which government is in power where. Unless that kind of a consensus, national consensus is built up, you will not find any answer to this problem.
Right. But Mr. Godbole, health, for instance, it's a tremendous, I mean, it's unfortunate, but it's also a tremendous business opportunity. It's not as if health necessarily is, devoid of profit. Vaccine manufacturers can make a profit. People who manufacture masks can make a profit. I mean, even in this adversity, there are business opportunities. I'm not saying that you make death a business opportunity, but disease and its cure is a business opportunity. So why do we have this attitude that health is something that should not concern the private sector? After all, our vaccine manufacturers are private organizations, and I'm sure if they had been told to manufacture well in advance, they would have done so.
Well, firstly, one must realize that education or health are the two areas in which private sector has made some inroads. But that is applicable only so far as urban areas are concerned. And that too, well-off sections of society are concerned.
And we've seen it.
Yeah, and common person cannot afford to go anywhere near these private hospitals. We are talking about large rural areas in which there is no alternative except for the government to step in and to provide these services. At least let there be a clear understanding that in urban areas or well-off sections of society, we will leave it to the private sector and the remaining will be dealt with by the government.
Right.
Let there be a national awareness, national consensus on this subject. Otherwise, for example, what we have seen, commercialization of education. For example, a person from a common household cannot, a boy from a common household cannot afford to get into any of these institutions,
right,
unless he has a government support. And therefore, it will have to be then partly government, partly private sector, or fully private sector. There was large resistance even to this contributory provident fund scheme all these years.
Yeah.
Now somehow it has come to be accepted in large number of areas, but that is again a very small percentage. What is the percentage of organized labor in the total economy? It's hardly 1%, less than 1%.
Exactly.
Therefore, these kinds of changes are good, but it will take a long time for that to percolate to the lower levels and to the poorer sections. And that role of the government, you will have to recognize and provide for years to come.
Right. At the end, Mr. Godbole, when you speak to some of your former colleagues in states and at the center, what do you hear? Do you hear frustration? Do you hear helplessness? Do you hear callousness? They couldn't care less. What are you hearing?
Depends on whom I talk to. There are people who are enjoying the situation. There are people who are very happy. Yeah, that's it. Because if you want to flow with the current, any dispensation is good.
Right.
If you want to be principled and you want to make sure that you have a satisfaction of having done a good job, then you are in a difficult position. And that is irrespective of which political party is in power.
Right. So the ones who want to work will always be in a minority. And,
yeah, sure.
And they will always be miserable. One of the reasons perhaps why you took voluntary retirement as well. Was that the reason?
Well, you will have to read my memoirs in which I have laid bare the way a civil servant goes through life.
Right.
And in fact, I had said at that time, this was way back in 1996, that I wanted the people to realize that life of a civil servant, if he wants to be true to the Constitution and to the principles, is not an easy life. And he has to be prepared to give up everything that he has acquired over a period of time in terms of his reputation, in terms of his career, etc., if you want to stick to that principle. For example, I resigned. Immediate cause for my premature retirement was that my advice regarding Babri Masjid was not accepted by the government. And then after Babri Masjid was demolished, then effort was made to fix the responsibility or to make a scapegoat out of those in the system, which is something which bothered me.
Right.
In fact, all the time for over 2 years, we were recommending all through that the UP government is not going to protect the masjid unless you step in and impose precedence rule. And for that purpose, elaborate mechanism was suggested. Very large force of over 20,000 was congregated near Ayodhya, but political leadership did not want to take a decision. And then finally, somewhere, then responsibility has to be fixed in, I hope in COVID situation, that does not happen. Responsibility must get fixed for all the wrong things which have happened, for things which have not been done or have been done wrongly by proper forums like Parliament. In this particular case, as you know, nothing came out of it. That inquiry went on for 18 years.
Yeah.
People have forgotten about the whole episode.
Yeah.
Parliament, the Supreme Court has put its own seal in a way on all that happened. And that's the sad chapter in the country's life.
And people who were there have mysteriously not been there, you know. People who were witness to everything have suddenly not been there.
That is what happens in most of these situations.
I do hope things will be different with this, but I don't, I'm not too sure it will happen. Thank you very much for your time, Mr. Godbole, and for your insights. And I do wish that they're listened to and they're acted upon. Thank you very much.
Thank you. Thanks a lot.
डॉक्टर्स का सबसे भरोसेमंद सैवलॉन एंटीसेप्टिक लिक्विड है कोविड-19 कोरोना वायरस पर असरदार।